Hi, my name is Dr. Cristina Tolentino, and I am here today to talk to you about abnormal pap smears. The pap smear is now known as the cervical screening test, or CST. The reason for this name change is because the new CST is now able to detect changes earlier than the old pap smear did. So, if you get a normal CST, this now lasts for 5 years instead of the previous 2 years with the old pap smear. Now, if you have received notice of an abnormal CST result, please do not worry. The cervical cells take years to change into cervical cancer, and the incidence of cervical cancer in Australia is very low, which is only about 1.4% per year. This is because in Australia, the cervical screening program is very well followed up by GPs and gynecologists, as well as patients attending their tests regularly. An abnormal CST means one of the following: positive human papillomavirus or HPV, the presence of abnormal cervical cells, or both HPV and abnormal cervical cells. If it is your first time getting an abnormal CST, we would usually advise you to repeat the CST in 1 year. This is because after studying the behavior of HPV virus, we know for a fact that most of us will clear this virus on our own, using our own immunity, much like we would get rid of other viruses on our own. This is why it's very important to keep up our immunity by exercising a healthy lifestyle, eating healthy, regular exercise, and not smoking. At times, we will refer you to the specialist gynecologist for further testing, such as when you test positive for an HPV type that is more aggressive than others, or when we detect higher grade abnormal cervical cells. The gynecologist will perform a test known as a colposcopy. A colposcopy is pretty much similar to a pap smear or CST, but with using a device called a colposcope. The colposcope allows the gynecologist to see the cervix more clearly and in a magnified view, so that she can decide whether you need a biopsy done. If this pattern of follow-up is done, very few women will progress to cervical cancer. This is why the cervical cancer incidence in Australia is very low, because of efficient follow-up. This is also why we urge every woman between the ages of 25 and 75 to present for their pap smears and CSTs on time when they are scheduled. Disclaimer: any of the content in this presentation is not to be relied upon by people viewing this as being in the manner of a medical consultation. All medical information in this presentation is general in nature and is in no way to be taken as clinical advice. Viewers are advised to contact their own doctor or other health professional in relation to any individual clinical concerns they may have. Thank you for listening, and please do not hesitate to book an appointment with your GP or gynecologist if you have any concerns.